So, in this video, we'll be discussing about the most common presentation seen in every medicine ward, that is diarrhea. So, in basic word or in simple words, we can say diarrhea means what? Stool water content more than 200 ml per 24 hour. In simple words, we can say that is stool water content more than 200 ml per 24 hour. Now, more precise with the help of Bristol stool chart, we can categorize different types of stool into type 1, type 2, type 3, type 4, type 5, 6 and 7. So as you can see in the picture, type 1 means they are seen as separate hard lumps and that is seen in case of severe constipation. Type 2 it will be lumpy and sausage like, which is mild constipation. Type 3 and 4 is the normal one, that is it is sausage shaped, cracks in the surface, and type 4 is smooth, soft sausage or snake like. Now soft blobs with clear cut edges means lacking fiber in our diet, and mushy consistency with ragged edges is mild diarrhea, and severe diarrhea, as you can see in the picture, liquid consistency with no solid pieces, that is severe diarrhea. So from the nature of the stool we can talk upon the health of our gut. Okay, now diarrhea is classified based on duration into acute diarrhea, persistent diarrhea, and chronic diarrhea. Acute diarrhea means duration less than 2 weeks, and the most common causes is infection like viral. In adult, it can be due to norovirus, in children due to rotavirus. Then persistent means it lasts for more than 2 weeks, and chronic, which is a serious problem which lasts for more than 4 weeks, and under this we have osmotic diarrhea, secretory diarrhea and inflammatory diarrhea. So first let us discuss about osmotic diarrhea. So osmotic diarrhea is basically due to what? Malabsorption. So what are things that is being absorbed in our body? Mainly three things are absorbed, three nutrients: fat, proteins and carbs, that is carbohydrate. And the 90 to 95% absorption is taking place in the small intestine, isn't it? So malabsorption, the hallmark of malabsorption is nothing but fat. So in osmotic diarrhea also we are talking about the malabsorption of fat, and when the fat is not absorbed, it will be present in the stool, and the stool will be seen as what? It will be seen as pale, bulky, malodor, and the stool will be greasy in appearance. But the patient will not come to the clinic with the presentation of this problem. He will present with what? Diarrhea only. And why in case of malabsorption of fat the patient is presenting with diarrhea? Let us see. So fat is not being absorbed in the small intestine, so it reaches where? Of course in the large intestine. So what happens is the solute content increases, so the osmolality increases. When the osmolality increases, more water is drawn from the large intestinal epithelium, so along with stool more water, so that is known as osmotic diarrhea. And the peculiar feature is the stool will be seen as if oil droplets are sprinkled on the water. You can see oil and water is never able to dissolve together, so it will be seen as separate entities. Now the characteristic features in an osmotic diarrhea is when we are keeping the patient on fasting, he will improve subsequently. So the response to fasting improvement is there. Why? Because on fasting there is nothing is being absorbed, no fat is being taken. So no fat being taken means fat is not being present in the large intestine, so the stool will be normal. That means there will be improvement. And also osmotic gap widens. So what do you mean by osmotic gap? Osmotic gap is measured minus calculated. Okay, measured osmolality minus calculated osmolality. Calculated osmolality is 2 into stool sodium plus stool potassium. Okay, this is the calculated, which is yes, calculated. So measured osmolality will be increasing because solute content is being increased. So osmotic gap, basically this, when this increases, the whole thing will increase, so it widens. Now there is a diagnostic or gold standard test to check whether steatorrhea is present, that is known as what? It is known as, yes, 72-hour fecal test. So what we are doing is, we will give the patient 100-gram fat diet will prescribe for 5 days, and the last 3 consecutive days, that is day 3, day 4, day 5, if the stool fat content is more than or equal to 7 gram per day, it is diagnostic. Now coming to secretory diarrhea, it is mainly due to toxins and tumor. Toxins like what? We can say toxins produced by enterotoxigenic E. coli, Vibrio cholera. Tumor like VIPoma, that is vasoactive intestinal peptide secreting tumor. So in toxins, they will increase cyclic AMP. So tumor example is VIPoma. So how can you differentiate secretory from osmotic? The same two features, that is osmotic gap and response to fasting. So here there is no improvement on response to fasting, where in secretory diarrhea no improvement, and osmotic gap, yes, what will happen, it will decrease. Why? Because we know osmotic gap is what? Yes, osmotic gap is measured minus calculated, and calculated is stool sodium plus stool potassium. So in osmotic diarrhea, there will be what? Sorry, not in osmotic, secretory diarrhea, there will be hypokalemia. Okay, hypokalemia will be there, and also sodium loss also will be there. So this entity will decrease. So basically osmotic gap decreases. Now let us differentiate between large bowel diarrhea and small bowel diarrhea. So large bowel diarrhea, the stools is small in quantity, whereas in small bowel it is large, watery. Frequency is more in large bowel diarrhea. Now abdominal cramps and bloating present in osmotic. Why? Because the fat being not absorbed, it will be fermented in the small intestine, produces gases. So bloating sensation, abdominal cramps will be there. Now blood, mucus, pus will be present in the stool in case of large bowel diarrhea, and fever, abdominal pain present in case of large bowel diarrhea. And large bowel diarrhea, it can be due to invasion like shigellosis. Okay, and small bowel diarrhea as seen in osmotic diarrhea, secretory diarrhea. So that is a nutshell about diarrhea. The all the basic things that we should know about diarrhea has been discussed in this video. Hope you all got some idea about diarrhea. Thank you.